You wake up and your hands feels stiff, swollen, like someone poured cement into your joints overnight. Is it just age, much typing, or is your immune system quietly turning on your own body? Hi, I'm Dr. Jessica Chapman, and this might be the most important video you watch if you're living with joint pain. Today, we're breaking down the real difference between osteoarthritis and rheumatoid arthritis because one comes from use and the other one comes from your immune system misfiring. And here's the truth. If you're treating the wrong one, you could be doing more harm than good. In the next few minutes, you'll learn how to spot the key signs of each and what to do if you're not sure which one's waking you up every morning. Let's get started. You might hear arthritis and think, isn't that just something older people get? A little creaky here, a little stiff there. But arthritis isn't one disease. It's a word we use to describe over 100 different conditions that affect joints and sometimes the entire body. Inside every joint is a little miracle of design. Cartilage acts like cushion. Synovial fluid works like oil in an engine. And together, they let you bend, twist, walk, type, dance. But when arthritis hits, something breaks down in that system, causing pain, swelling, stiffness, and sometimes even permanent joint damage. And here's what matters most. Not all arthritis is created equal. Some types are slow and mechanical, like tires wearing down. Others are fast, aggressive, and driven by your own immune system. In the next few minutes, we're going to look at the two most common types, osteoarthritis and rheumatoid arthritis, and show you how to tell them apart by the signs your body is already giving you. Because the earlier you recognize the difference, the better chance you have to protect your joints from the long run. Let's start with the more common of the two, osteoarthritis, or OA for short. People often think of OA as the price of getting older, the joints wearing out, the cartilage thinning, but that's only part of the story. OA isn't just about aging. It's a degenerative joint disease and can show up much earlier than people expect, especially if you've had an old injury, repetitive joint stress, or carrying extra weight on from your frame. Imagine the cartilage in your knee is like the tread on a tire. With every step, that tread wears down. And once it's enough, your bones start rubbing together with each other. Painful? Yes. Gradual? Almost always. Preventable? In many ways, in many cases, yes. What causes OA? Time takes its toll, but it's not just the only factor. Old injuries that high school ACL tear, it might come back to haunt you. Overuse, jobs that involve kneeling, squatting, or repetitive motion stresses joints. Genetics. Some of us are just built with joints that wear down faster. Obesity. Every pound puts extra pressure on your knees and hips. Women over 50 are more likely to be affected as well. If you've got OA, your body usually whispers clues before it shouts. Here's what to listen for. Pain with use. Your joints ache more the longer you're on your feet. Brief morning stiffness, usually gone in under 30 minutes. One-sided involvement. One knee might hurt while the other feels fine. Limited motion. You can't fully bend or straighten the joint anymore. Grating sounds. That's crunching that you're hearing, we call that crepitus. Bony enlargements, hard nodules in the fingers, we called Heberden nodes, as well as Bouchard nodes. And importantly, OA is localized. It doesn't cause fatigue, fever, or affect other organs. It's a joint problem, not an immune. So if you've got pain that gets worse with movement, improves with rest, and sticks to one side of the body, it might be OA. But if that pain comes with morning stiffness that won't go away, or you're feeling tired and achy all over, that's a red flag for something else. Now let's talk about rheumatoid arthritis. And if you're younger and dealing with joint pain, this one's especially important. RA is not about worn joints. It's about misfiring of the immune system, attacking your joints from the inside out. Your body is trying to protect you, but it gets the signal wrong. Instead of targeting virus or bacteria, it targets you. What triggers RA? We don't know exactly what flips the switch. But here's what we do know. Genetics plays a role, especially if you carry a certain HLA gene. Smoking is a huge environmental trigger, especially if you're genetically predisposed. May explain why RA affects women 3 times more than men. And RA doesn't wait for old age. It often shows up between the ages of 30 and 50, right when life is in full swing. What does RA feel like? RA usually comes with morning stiffness that lingers an hour or more, sometimes all morning. Pain after rest, not movement. Sitting too long makes it worse. Symmetrical joint pain. If one wrist hurts, the other probably does too. Squishy, warm feeling, swelling, not bony lumps, but soft inflammation in the joints. Systemic symptoms, fatigue, fever, weight loss, feeling unwell overall. And unlike OA, RA doesn't stop at your joints. It can inflame your eyes, your lungs, vessels, sometimes silently. Here is a quick RA checklist. Autoimmune, symmetrical, joint pain, stiffness lasting more than an hour, inflammation that's soft and warm in the joints, systemic symptoms like fatigue and malaise, starts in small joints like the hands, the feet, the wrists. RA pain isn't just annoying, it's dangerous. If ignored, left untreated, it can destroy joints and reduce quality of life dramatically. That's why catching RA early and treating it fast is so important. Because unlike OA, where we can manage wear and tear, with RA, we are trying to calm down the immune system or the immune attack before it causes permanent damage. Stay with me because now we've looked at both. We're going to break down side by side so you can clearly see the difference and know what to ask your doctor. You've met the contenders. Now let's put rheumatoid arthritis and osteoarthritis head to head, because this is where the real clarity begins and where many people finally realize, wait, this doesn't sound like what I thought I had. Let's break it down side by side. The root cause, cartilage wear and tear. RA, autoimmune attack on the joint lining. Onset, slow, years in the making. RA can come up quickly within weeks to months. Morning stiffness, under 30 minutes, often lasts over an hour and sometimes all morning long. More specifically, the pain pattern. OA, worse with movement, better with rest. RA, worse after rest, improves with gentle movement. Symmetry. OA, asymmetrical. One side is typically worse than the other side. Symmetrical. Both sides are typically equally affected. Swelling, hard, bony, often from osteophytes or bone spurs. RA, soft, warm, and squishy due to inflammation. Systemic impact, local joint damage only. RA can affect the whole body, fatigue, fever, and organ involvement. Think of it this way. OA is like a tire slowly going bald. You feel it with every mile. It's predictable. RA is like a fire under the hood. It spreads if you don't put it out early. And if you're watching this, think, I have pain, but it doesn't quite match either. These conditions can overlap. You can even have both at the same time. This is very common. Knowing these patterns helps you ask the right questions and push for the right diagnosis. In the next section, I'll walk you through how doctors tell these conditions apart, including the tests we run and what they mean. Because guessing isn't enough. We need clarity before we treat. So your joints are stiff, they're swollen, they hurt, and you're wondering, is it OA or RA? Something else. You're not alone. And here's the good news. Your body is giving us clues. We just have to know how to read them. Step 1. The most powerful tool we have is your story. Before we order a single test, we listen, we ask, when did the pain start? How long does the stiffness last in the morning? Are both sides equally affected? Do you feel tired all the time? And any family history of autoimmune diseases? These answers, they matter more than any lab result. We do a hands-on, we're looking for swelling. Is it hard like bone or soft like inflammation? Tenderness or redness? Symmetry, is one side worse or are both equally affected? Motion, can you fully bend or straighten? You might even spot signs you didn't realize mattered, like a nodule under the skin or inflammation in your eyes. Step 3, the tests. Let's talk blood work. Rheumatoid factor, or RF, and anti-CCP antibodies. These help us diagnose RA. Anti-CCP antibodies especially are specific for this condition. CRP and ESR, otherwise known as SED rate. These show if there's inflammation in your body. High levels are common in RA, but usually normal in OA. A complete blood count. In RA, we sometimes see anemia from chronic inflammation. Step 4, we often start with x-rays. In OA, we might see joint space narrowing, bony spurs, or subchondral sclerosis. In RA, early x-rays might look completely normal, but later they show erosions or joint damage and bone loss. These are a sign that the immune system is attacking the joint. Sometimes we need ultrasound or MRI to catch inflammation early, especially in rheumatoid arthritis. Step 5, joint fluid analysis. If a joint is very swollen, we might be able to draw out some fluid. This helps us rule out infection or crystal arthritis like gout. OA fluid, usually clear and non-inflammatory. RA fluid, full of white blood cells, a liquid biopsy of inflammation. This isn't guesswork, it's detective work. And with the right clues from your story, your joints, your labs, and your images, we can find out what really is going on. Because once we know the cause, we can start the right treatment. Next, what happens when we get it right and what's at stake if we don't? When it comes to arthritis, the pain might feel the same, but the path forward is completely different. Getting the right diagnosis early, especially for rheumatoid arthritis, isn't just helpful. It's everything. If you try to treat rheumatoid arthritis like it's osteoarthritis, not just masking pain, you're letting your immune system keep attacking your joints. The longer it goes on untreated, the more permanent the damage becomes. RA can deform joints, erode bones, and even affect the heart, lungs, and eyes. And once that damage is done, it's done. But what if we catch RA early? We can often stop the disease in its tracks. Yes, stop it. With OA, the goal is symptom relief and joint preservation. Exercise, physical therapy to strengthen muscles and support the joints. Weight management to reduce pressure, especially on the knees and hips. Pain relievers like acetaminophen or NSAIDs. Injections, corticosteroids or hyaluronic acid for temporary relief. Surgery, joint replacement in advanced cases. RA requires a completely different approach. We use DMARDs, disease-modifying anti-rheumatic drugs, like methotrexate, that target the overactive immune system. Biologics, advanced medications that block specific inflammatory pathways, corticosteroids and NSAIDs for short-term flare control, not for long-term use. This is where timing matters most. The earlier we start, the better the long-term outcome. I've seen patients go from barely being able to walk, hiking, gardening, dancing again, because we caught RA early and treated it right. But I've also seen the other side, people who waited too long, thinking it was just I'm getting old, until the damage couldn't be reversed. That's why this knowledge isn't just informative, it's life or potentially life-changing. So what do you do if you think you might have OA or RA? Let's wrap this up with what steps to take next. So here's what we've learned. Osteoarthritis is a condition of wear and tear. It builds slowly, hurts more with movement, and tends to stay local. Rheumatoid arthritis is a systemic autoimmune disease. It's aggressive, inflammatory, and potentially damaging beyond the joints. Same word, arthritis, two completely different diseases. And now you know the difference. More importantly, you know why that difference matters. If your joints are stiff, swollen, painful, or you feel run down without a clear reason, don't wait. Start the conversation with your doctor. Tell them what you've noticed. Ask about RA. Ask about imaging. Ask about blood work. Early diagnosis doesn't just help, it protects your future. Here at Rheum Doctor, our mission is simple: to give you the knowledge you need to advocate for your health with clarity, competence. If this video helped you, please give it a thumbs up. Share it with a friend and subscribe to the channel. There's so much more to learn, and I'm here to walk you through it. Stay informed, stay healthy, and as always, be kind to your joints. See you in the next one.